welcome everybody. My name is Carrie Bauer. I'm the Safeguarding Policy Lead and Training Lead here at Hourglass. Hourglass is the only charity UK-wide dedicated to ending the abuse, harm, exploitation and neglect of older people. Today, we're going to be speaking to our colleagues at Hourglass from Frontline Services and our policy unit, and I'll introduce them in a few moments. But first of all, some housekeeping. The topics we will be discussing today will be emotive, so please ensure you are in a safe space and take care of yourselves. If you need to mute us or end the recording, that's fine. You can leave. We will be recording today, so you will get a copy of that recording that you can watch back if you need to. We'll be sharing links in the chat to anything that we refer to. So we will be talking about our upcoming conference in November in Edinburgh. We will share links to that, our newsletter, some of the influencing and campaigning work we're doing, and how to access our frontline services. So please keep an eye on the chat, even if you're not using it, because the links will be in there. So Hourglass, for those of you that aren't familiar with Hourglass, as I said, we are the only UK-wide charity dedicated to ending the abuse, harm, exploitation and neglect of older people. We do that across all 4 nations. We have a 24-hour helpline, which can be accessed via telephone, text service, email and chat box. We also have a direct referral pathway for professionals, and I'll be speaking to Elizabeth and Aisling about that in more detail. We also influence, lobby and campaign to ensure that older people are visible in the conversations about all forms of abuse. For too long, older people have been invisible in these conversations, and we're dedicated to creating a safer ageing society by 2050. We do that through the influencing work that we'll be talking about, and I'll be talking to Gareth and Joseph about that influencing work and the policy work that we do. So a little bit about what we're seeing at Hourglass. Over the past year, we've had a 40% increase in contacts from older people, their families and professionals, and we envisage that that is only going to grow. The population is increasing of older people, but awareness is also increasing, and that's a good thing. But we need to be ready. We need to be able to respond to that need, and that's why we need your support. It's really important that we grow the conversation. Last month, we had World Elder Abuse Awareness Day, and the theme was growing the conversation. And this is a continuation of that ongoing conversation. So we invite you to support us. In the chat, my colleagues will be putting a link to our newsletter. We'd really encourage you to sign up to that so that you can see ways that you can support us. So as I said earlier, I am lead on the training here at Hourglass, and we will be launching some training in the next few months. If you wish to discuss with me your training needs, feel free to contact me at training@wearehourglass.org, and I think my colleagues will be popping a link in the chat to that email address. But without further ado, let me introduce my colleagues, and this group of colleagues represent the whole team at Hourglass. There's lots of people that you won't see here, from our CEO and our senior leadership team to our volunteers and our back office staff, fundraising team and digital colleagues supporting us. We're a huge team, and we have 5 of us here today, but we by no means represent everybody. So we're going to focus on our frontline services to older people first, and then we'll talk about the influencing work we're doing. So first of all, I'm going to be speaking to Aisling and Elizabeth. And Aisling is based in Northern Ireland. Aisling has, I've now got to go to my details of all Aisling's qualifications, but she's a frontline services officer. She's been with Hourglass since 2024, and she's got a bachelor's degree in health and social care from Liverpool John Moores University, which isn't too far away from where I live. Aisling brings a wealth of knowledge of health and social care systems to her role, and she works directly with older people who need our support. We also have Elizabeth Fox. Elizabeth, you lead our frontline services in England and Wales. You're an independent domestic violence advocate, which is also known as IDVA, and an independent sexual violence advisor, also known as ISVA. Elizabeth previously worked in health and social care. She's got qualifications in that, and her background is supporting older people across care homes, hospitals, and in community settings, and particular interest in palliative and end-of-life care. Elizabeth witnessed a lot of poor care in her previous roles and became very, very passionate and an active advocate for older people. So first of all, we'll talk to Aisling and Elizabeth, and then I will introduce Gareth and Joseph, because you've probably heard far too much of my voice. So Aisling, could you tell us a little bit about your role?
Yes, so my role, thank you for the lovely introduction there, Carrie, as well. So my role with Hourglass, I've been here just under a year, and yeah, it's just a whole wealth of knowledge within the past 9 to 10 months, really. So yeah, my role as a frontline services officer, I would have casework, and sometimes it might be up to maybe around 16 different cases or so, working with older people, older victims of domestic abuse. And my role in Northern Ireland as well. It's sorry, uh, I, I also do the helpline as well within Hourglass as well, and work along the whole team of frontline services officers.
So you very much sort of work from beginning to end with somebody, from somebody contacting the helpline, whether that's by phone, text message, on email, or a referral from a professional, right through to supporting them in whatever way. What sort of themes and challenges do you find supporting older people?
Yes, so things sort of with challenges, I suppose, for Northern Ireland, maybe there's a lot of rural isolation within this area, and certain challenges with legislation and different policies as well, which I'm sure, of course, Gareth and Joseph will go into later, and the sort of lack of awareness, really, of what older or elder abuse is. I would go to different pop-up groups, pop-up events, and speaking about elder abuse with older people. It is a lot of there is definitely a huge element of shock that older people aren't really they're not on the main sort of point of concern, but there is a lot of concern that is there, and it's about raising that awareness and speaking with the right people and getting the right support for them.
So you've got quite a varied role. You'll be on a helpline, you might be working directly with people, but then you'll also be doing the awareness raising with members of the community, but also professionals as well, won't you? So it's a real varied role.
Yeah.
Elizabeth, could you tell me a little bit about your role and how that differs?
Yes, thank you ever so much. Well, I've been very fortunate to have quite a progressive job role here in Hourglass, and I'm now the frontline service lead for England and Wales. So I actually work alongside 2 other frontline service leads who cover across the 4 nations with myself. Together, we support the frontline service officers and older persons advocates to lead on providing support and options to older victims of domestic abuse. I carry a caseload, so I support on a one-to-one basis with victims and older victim survivors of domestic abuse. I provide individualised support, and I also support my staff, my team, who also carry their own caseload as well, and they provide one-to-one support to their victim survivors. Between myself and the other frontline service leads, we risk manage the team and all of our colleagues. We also risk manage their cases as well. So we offer team discussions, one-to-one meetings, updates and feedback on their cases, quality assurance and things like that, to ensure that we're providing the best support that we can to the individuals that come to our service. We operate by consent only. So we receive referrals through various means, such as, you mentioned the helpline, text message, instant messenger. That could come directly from a service user or victim survivor themselves, or it could come from a professional. We engage with the service users directly to complete risk assessments. We discuss their individualised options based on the risk level and the circumstances of the individual. We also work with professionals on cases as well that we may not be leading on at the time, but they want our professional feedback and information on the case. So we do multi-agency meetings and multidisciplinary meetings where we're invited in to share some of our feedback. And similarly to Aisling as well, I also help on the helpline. I support with that awareness raising, training and sharing, and also leafleting and things like that. So yes, a lot that we do here.
Really, really varied role. And what should people expect when they contact the helpline? So an older person who has some concerns, they might not be able to articulate exactly what's happening to them, but they're worried enough to make that leap, because it is a leap when you contact a helpline. What can they expect when they make a phone call or a text message?
Well, we've got all of our trained frontline service operators on the helpline, and it runs 24/7. So at any point of the day or the year, you can call up and expect a non-judgmental discussion about your individualised circumstances. We often get a call from maybe the family or a friend who's looking for advice for a loved one. So we can give them the options around safeguarding, safety planning, maybe some processes or accessibility around who to contact, maybe at the local authority, housing, things like that. And if it's the victim survivor themselves, we can have a discussion around signposting them onto some other partner agencies, or those different various options that are available for their needs. We can also suggest legal and safety advice and planning. We can discuss those onward referrals to other services and support, and provide information around power of attorney, also adult child to parental abuse, even predatory marriage. That's just to name a few kind of subjects that come up on the helpline. So yeah, we are working in that person-centered, holistic, transparent way that we can be open with the individual as they call through, because we understand there may be barriers against terminology, some of the phrases that they use, and also around concerns where somebody may be losing capacity, dementia might be kind of overtaking, and the concerns there where they don't maybe want social services or other services involved, and those barriers and challenges. So we try and give as much information and advice and options to them so that they can go out and feel empowered to either speak to their loved one about the concerns that they've called in for, or take actions themselves.
That's great, thank you. And we very much will collaborate with other specialist organisations, won't we? Because older people aren't a homogenous group defined solely by their age. They have lots of unique, as we all do, identities, and what we might identify with different service provision, but actually need that older person's lens and that understanding of the particular nuances and dynamics. So it's really important as an organisation that we collaborate with specialist organisations, and I'm sure many of them are on the call today. So we're really keen, aren't we, to develop those referral pathways. How can professionals contact us and develop those referral pathways?
Well, we invite anybody to call through to the helpline. If they wanted to make a query, we can take their email address from the helpline and we can contact them directly, and we can get in touch with them and we can start having that conversation about building that referral pathway, how we can develop maybe a partnership. We've got our Give an Hour scheme. I mentioned some legal advice and things earlier. We do have our partners that work in the Give an Hour scheme who can offer over the phone 1 hour initial advice, just to kind of maybe ask some of those questions that the service user doesn't know the answer to, and again empower them to make that next choice. We've got the development and looking at policies and research as well, so we work closely with the research and policies officer. We also have lots of people come through from university, so dissertations, discussions about studying and things like that. Really good way to kind of link up and make those pathways and kind of strengthen, as you say, what we do. And it's really important to have that intersectionality and that multi-agency working.
Excellent, thank you, Elizabeth. And Aisling, typically, and I know this is kind of a how long is a piece of string kind of question, but typically how long do we work with people?
It varies, yeah, and you're right in saying that. Yeah, it would vary person to person really on what their needs would be. But yeah, we would offer one-to-one casework over the phone support, and we would start with about 6 sessions. But of course, it just depends on the needs, whether it's they may be weekly sessions, they may be maybe every month, and it just depends how they would want their support and how they would how we would kind of change the support around them for what their needs are. But yeah, no, initially 6 sessions, but it could be longer depending on needs, or shorter maybe depending on needs as well.
Thank you. And Elizabeth, some people often think if they're accessing a specialist service, they have to kind of go down a criminal justice route or a particular route. Can you just offer some reassurance to anybody that's considering contacting Hourglass or referring somebody to Hourglass, what the expectations are in relation to that?
Sure. Well, we are a completely confidential service and we run on consent only. So it would be consent of the individual for us to engage with them initially. We would need consent, to share information with them and onwards to other partners and other services. In regards to reporting to other services or contacting, we would initially kind of have that touch-based safety planning with that individual. And we would talk around a discussion about contacting relevant services and the benefits to contacting those services. So, for example, everybody could be aware of the risks and the potential abuse occurring. And we would, again, document this in our own safety planning. But we do understand that individuals may not feel confident to contact police or other services. And this may be due to kind of past experiences, outcomes, or their own personal barriers. A lot of our service users don't want to criminalise their family members, especially if it's their older children and they're a parent. So, it is completely up to the decision of the service user who they would like to inform about the incident occurring. We are here just to give those options and advice and, like I said earlier, empower them to make that next choice. However, that being said, if we did, as a service, feel that there was a significant risk of life, as a duty of care, we would look to make a safeguarding or a police contact for the individual. But generally, overall, it's completely up to them.
Thank you, Elizabeth. You covered that really well. So, as safeguarding policy lead, you really covered that well. So, thank you. So frontline services, that is the frontline services in a nutshell. Obviously, very, very complex work that you're undertaking day in, day out. The helpline is 24 hours a day. And the majority of Hourglass's charitable funds is focused on our frontline services. But underpinning that work is our policy, research, and external affairs work. So I'm now going to talk to Gareth and Joseph about the work that they do across all 4 nations. So first of all, Joseph is the external affairs lead for England and Wales. Joseph champions the rights and voices of older victim survivors of domestic abuse, exploitation, harm and neglect. And he joined Hourglass following a decade stint in Westminster, where he worked for several MPs and ministers as a researcher, advisor, and most recently, chief of staff. I can see everybody hates being introduced, don't they? You cringe at it. I can see Joseph cringing there. In your role at Hourglass, Joseph, you lead engagement with policymakers, ensuring experiences of older adults are represented in legislative and public discourse. You represent Hourglass in Westminster and the Senate, and you drive calls for comprehensive and inclusive strategies to address the abuse of older people. Gareth has a very similar role. So you lead on external affairs in Northern Ireland and Scotland. And before joining Hourglass, you worked as policy and public affairs manager for a mental health charity, Mindwise. You were a researcher and a historical institute abuse inquiry for Northern Ireland. You were also involved in setting up the Truth Recovery Independent Panel, which forms part of an integrated truth investigation looking into the workings of mother and baby institutions, the Magdalene Laundries, which I know is very much in the news at the moment. Gareth, you've done lots of work in Northern Ireland, but you're also, part of your role is in Scotland, and we have a conference coming up soon, don't we, in Edinburgh in November, so we will be talking about that. But first of all, Joseph, like Elizabeth, you lead England and Wales, but you've got a very different role. Could you tell me a little bit about what you do? I know I've introduced you, but you can say it far better than me.
Okay, yeah, I am sorry for publicly cringing at the intro. I think you're right, most people
We all
don't
do
like
it.
it. But some of that was reminiscing about some of those decades, well, some of those 10 years I spent working for MPs, just remembering some of that. That makes me cringe. Yes, I do cover England and Wales, but a very, very different role to Elizabeth. So my main focus is on policy and lobbying. So to put it simply, I make sure the voices of older victim survivors are heard where and when the decisions are made. So I work with MPs, civil servants, and other organisations to change policy, and in some instances try to secure funding to ensure older people are visible in safeguarding and domestic abuse strategies. As we all know, older victim survivors and older people generally are overlooked in these conversations for many reasons. And my role, along with Gareth's in Northern Ireland and Scotland, is to make sure that doesn't happen. As part of that, we engage in briefings, consultations, public awareness, roundtables, whatever we can really to input ourselves right into the heart of those decisions. We also take part in webinars like this, podcasts, and conferences, including our own, on the 12th of November, which Gareth's going to speak a bit more about later. There's a lot more we do within external affairs, but I don't want to talk forever about it. But yeah, I'm sure we'll get into that later in the conversation.
We'll get into it. And as you were speaking, I just remembered that I didn't say at the beginning of this webinar, feel free to use the chat, but if you have any questions for our panel, including me, please pop them in the Q&A box. They're much easier for us to spot if they're in the Q&A rather than the chat box. So please do, as we're talking, if a question pings up in your mind, feel free to pop it in the Q&A. There will be plenty of time for questions. So Gareth, you have a similar role to Joseph, but it differs slightly in terms of nations. Could you explain about your role?
Yeah, so just similar to Joseph, except that I look after the Northern Ireland and Scotland, and today I've turned up looking like an AI-generated version of somebody who does that role, because I've got a sort of green tartan shirt on and I've got a ginger beard, so look like I'm a sort of robot doing this role. But apart from that, yeah, I didn't realize until I looked into the camera. Yeah, so really it's looking at those two devolved nations. A lot of crossover in the issues, but obviously there's sort of very distinct issues in Northern Ireland and Scotland. Particularly in Northern Ireland, the nature of government here has made it a bit more difficult to advocate for older people or any sort of groups, because government's been up and down. So it means being a wee bit more tactile for any community and voluntary sector organisation and how you work. And that means not putting all your eggs in one basket in terms of working with government. You might have to work with council, work with civil servants, keep up those relationships. So in the long term, it's always making sure you have those relationships embedded. But in terms of the politicians day to day, those relationships are important. So in terms of the day-to-day priorities that are set out in our manifesto, in Northern Ireland, the big one at the moment would be the Adult Protection Bill. We were very strong on that becoming legislation. And thankfully, in the last few weeks, that's reached committee stage. So it's out for consultation. We will be putting in a written submission to that consultation. And I think Hourglass will have a very important voice in terms of scrutiny of that consultation and bill over the next few months, as it passes into legislation, to make sure that it represents the voices of older people and all vulnerable people in Northern Ireland, particularly around powers of entry for social workers, where they believe that there has been a case of abuse or neglect. We also in Northern Ireland want to see, we're supporters of the Violence Against Women and Girls strategy, but we want to see more work done to make sure older victims and survivors' voices are heard. So that means doing a wee bit of work on a consultation around a strategy on older victims and survivors of abuse and neglect. So that would complement the VOG strategy. It wouldn't necessarily overtake it. It's a bit of complementary work. And in terms of Scotland, we want to do a bit of work on an economic abuse strategy, and we're supporting the Commissioner for Older People bill that's in front of Parliament at the moment. So there's a lot of different things being done, but it all complements each other same as what Joseph's doing. It's all the little threads that we're pulling together to make sure that we're building a safer age in society for all older people.
Yeah, and it's interesting, you talked a lot about relationships there, and actually that's the kind of golden thread that runs through all of our work, isn't it? Whether that's relationships with, decision makers, or the relationships we have with older people to trust us, to support them. It doesn't matter at what level or who with, relationships are key in our success. And that's why kind of these webinars are great, because we really want to encourage other professionals to kind of build that relationship with us and collaborate with us to support us in whatever way that they can. So Joseph, what are the priorities for England and Wales at the moment?
So, I mean, the biggest priority is we're kind of waiting for it really, and it's the VOG strategy, which anyone who's working in the sector is very keen to see. It's been delayed and delayed and delayed, and probably delayed again until after the summer. I don't know, but we are ready to analyse it and respond to it, obviously through the lens of the abuse of older people. What we really hope is that when it comes, it's properly funded, because if it isn't, then the whole thing's kind of pointless, really. So we hope the Home Office has been winning the difficult conversations I'm sure it's having with the Treasury, probably right now. We're also quite concerned about how the government is going to measure success around its aim to halve VOG. If older victims aren't counted properly, they're not protected properly, simply said. So whilst we wait for that, we're busy, all of us really, trying to shape the 2025 conference, the Safer Ageing Summit. We're hoping that's going to be a real moment for embedding the abuse of older people into the national conversation. I've also recently been doing some work raising awareness of the new Advent is for Guidance, which was released at the end of May by the MOJ. This was, I don't want to say a rare piece of positive news, but a reasonably rare piece of positive news for us, in that for the first time it enshrines support within the new Advent is for framework. For the first time, it means that OPVA roles, which is older persons, domestic and sexual violence advocate, are now official specialist strands within the guidance, and the expectation is that every local area should have these roles, at least in some respects. So we've moved away from a kind of nice to have to we expect these roles to exist, which is obviously huge for an organisation like ours. But we want to see active commissioning, proper funding, training, and multi-agency coordination to go with that. So I've been working with PCC offices to try and make sure that everyone knows about this new guidance, and that Hourglass stand ready to support them. In England, there's some other sort of ongoing priorities, as well as what Gareth said about wanting a strategy for preventing the abuse of older people. We want that everywhere across the four nations. We want it in England, we want it in Wales. England's a little bit behind in that it doesn't have an office, like a commissioner for older people like they do in Wales, and there's one in Scotland, there's one coming. But we want to see that in England. We also want to see a minister for older people in England. We used to have one, we don't anymore. There are a couple of more specific campaigns that we'll be emphasising a bit more later in the year, such as powers of entry for social workers. It's quite specific, but very important. We support that. And also something about the reforming the Forfeiture Act to make sure that perpetrators don't benefit when the people they've abused die, essentially. And I think that pretty much covers England. Wales are a little bit further ahead when it comes to supporting older victim survivors, in that they have a yearly plan, which we're expecting a review of soon, about the abuse of older people. They also have a commissioner for older people there that we meet regularly with. But you know, there's still a lot more that can be done in Wales. We have a safer aging index, which we hope that they will fund as a government in Wales. And yes, I mean, there's plenty of other smaller campaigns going on there, but I don't want to ramble on about it. So yeah, I'll end that there. But yeah, that's essentially a wrap up of what we're doing in England and Wales.
So lots happening, and UK-wide means that, you know, we're working to lots of different definitions, aren't we, here at Hourglass? The definition of domestic abuse, but also safeguarding legislation. It all is quite different. So it can be quite complex work in this area, and I think it's really what we're really striving for is consistency across all 4 nations. That would be the ultimate goal, wouldn't it? Because that would really help drive that work. In terms of what's happening in Northern Ireland recently, Gareth, you held an event in Stormont. Could you tell us a bit about that? We had quite a few colleagues there. Aisling, you were also there.
Yeah, myself and Aisling co-organised that event along with Colin Scott and Veronica, our Deputy CEO, and Richard Robinson, our CEO, and Sarah Brown, our Vice Chair, came along. So basically what that was, it was up in Parliament Buildings, which for anyone who's been there, it's a lovely, very picturesque building in East Belfast where the government meets, the Assembly meets. It's a lovely place. It was a lovely day. It was basically a small event. It was an awareness raising event. It was basically just to get the name Hourglass out there for people who either didn't know who Hourglass were, or for people who did know what Hourglass does in Northern Ireland. It was a chance to celebrate what we do and reiterate what Oath is about primarily, and to talk about what we can do to support members of the Assembly and their constituency support staff in terms of signposting and you know, the early warning signs of abuse in constituency offices. And Aisling touched upon it earlier there. One of the big things that was raised, I did a presentation to the Committee for Health back in January, and one of the things that was raised was the rural issue. You know, it is a big issue in Northern Ireland because there's so many, it's a rural nation. There's so many areas where people are isolated and don't have those networks that you would have in an urban area. So it was a nice chance to have MLAs drop in, hear more about what we do, give them a chance to sign the oath, find out what it's about, what our aims are for a safer aging society by 2025, what they can do, and basically what the deal is between them as legislators and the public, what they and the public can do collaboratively to make for a safer aging society. One of the other really encouraging things on the day was that there was one of the politicians had a school group in shadowing them, and the school group came in, and a couple of the teenagers were really knowledgeable about the subject of abuse and neglect of older people, and were able to talk about it with some expertise. So it gave us a lot of hope that the next generation is quite tuned in to the issue of abuse and neglect of older people. So I don't know if Aisling wants to come in and talk, because I mean, I'm always aware. I think it's important to have the policy and frontline services, because we're here to support what the frontline services do. And I think it worked really well to have Aisling there. So if you want to give your perspective, Aisling, maybe.
Yeah, no, that was a really important day for getting the message out there and really just speaking with people. And again, you're just having that sort of shock that this is happening to older people. And you know, it's really, even from that younger group that came in the school group, they, you know, I think they did like they were doing something on it recently in schools to do with older abuse. So it's, it was really nice to hear that you know, it is being looked into a bit more seriously and things like that. But yeah, no, it was a really good day just for MLAs and stuff to sign the oath to kind of give that hope of the next thing for 2050 as well, which is what we want to see. Yeah, no, it was a really good day for getting the word out there, and it was a warm day as well. Remember, we had a few banners blowing down and things like that because of the wind, but yeah, no, it was a few hiccups, but that's expected. Of
I think
course.
it was really interesting what we encountered. You know, you had a range of people who knew what Hourglass were about. They reiterated their support. You had people like Claire Sugden, who's got a proposed bill on ageism in access to goods and services. And she'll be speaking at an upcoming Hourglass webinar in September.
Yeah.
So that's really good. But then you had some other MLAs who were of the opinion that, you know, abuse of older people only takes place in care homes, and that's something that is prevalent in wider society. So it's about winning the hearts and minds of people like that, and educating them, and working with them to sort of recalibrate those notions that is not exactly, that's not the narrative. We'll have to recalibrate the narrative, and that's what we, myself and Joseph, are the sort of entry point for that sort of recalibration. We support Frontline Services in terms of promotion of the service, but also it's about recalibrating the conversation and the narrative as well. So hopefully we did a few different things on that particular day. But yeah, it was a really lovely event, and you know, it was nice to gain a few new supporters in Northern Ireland.
I think what Gareth says about sorry, Carrie, about when as external affairs we meet MLAs, MSPs, MPs, people in power, is that they do have misconceptions when we speak to them, but they are extremely receptive to the messages we have to offer. And once they kind of get some of the facts and statistics and some of the information that we have from our helpline, from our frontline services team, they're very, very receptive and understanding, and they want to tell their respective leadership about the issues that we bring forward to them, particularly the issue that Gareth mentioned just then about victims being about care homes and abuse in care homes. Members of the public and most people in Westminster would believe that most abuse happens there, and we all know that it happens in the home by close family members. But yeah, most people don't know that, and when they do, they want to tell people about it, which is good, and that's part of our role, really, to spread those messages.
I think when you back it up with particularly what I find really powerful, whether it be speaking to the health committee or speaking one-on-one with MLAs or their staff or whoever, using stuff like our YouGov, the survey we did with YouGov on the economic abuse by numbers. So the economic abuse stuff we did around Safer Aging Week last year, it's available on the website. It's just those short, sharp statistics. You know, how many percentage don't believe that taking money from a person's house or scamming an older person via telephone isn't a form of abuse. I mean, you can tell when a politician's putting on, you know, shock for the sake of it, or when they're genuinely shocked as a human being. And 100% of the time, I find that people are genuinely 100% shocked, that they're actually disgusted at what they're hearing, that the prevalence of attitudes at the moment, that, you know, people don't see this as abuse, and they do think, you know, this is something we need to tackle here. So it's actually that short, sharp shock. You've hit them with the recalibration around, it's not just in care homes, it's actually close family in the home. And actually it's these sort of really disturbing statistics that, you know, older relatives are seen as sort of, you know, a free bank, or, you know, you can just go in and, you know, take money, or they don't care about being scammed via telephone or internet. Well, you know, we need to do something about this. And then that's where you build the ask for a strategy around that, and that's where you begin to get the real progress. It takes time, but that's where you make the inroads, and that's where it's important to have voices like Elizabeth and Aisling as well, and yourself, Carrie, as well, you know, to work together, and it all comes together as a team effort then, and you see the results further down the line. I think it takes time, but it's worth the effort.
It does take time and a lot of tenacity, doesn't it? And I think most of us here on the call, but also at Hourglass, have been passionate about this topic for many, many years, and you know, we're working to it, but we know it's a marathon. We know it's not going to happen quickly, and we keep on. And again, you know, back to that, it's relationships that are key, aren't they? Before we move on, because I want to talk a little bit about ageism, a lot about the conference, and a little bit about some of the data that we see at Hourglass, just to really bring that to life. You know, Gareth, I'm all about storytelling, and in our training we do a lot around storytelling and really unpacking this. We can't do that in a webinar, so if anybody is keen to have training for professionals, I'll keep plugging our training. We can deliver that in much more comprehensive style to suit your needs. But before we do, I'm conscious that some people here in attendance won't be UK wide and won't know the difference between an MP, an MLA and an MSP. Could one of you explain it, please, in layman's terms?
Joseph, I'll give you the pleasure.
Yeah, all of those little shortenings are just they're essentially decision makers in each of the four nations. So MPs is members of Parliament. That's Westminster. That's in England, but some of the decisions are UK wide, not all of them. And in Scotland, you have MSPs, or members of the Scottish Parliament. They sit in Holyrood. You have MLAs in Northern Ireland. These they sort of roughly do the same things within their four nations, depending on the powers that they're given. And you have MAs in the Senate, Assembly members.
Excellent, thank you. And anybody that's studying politics, that's really helpful. Yeah. What was that, Joseph?
MS is in the Senate. They changed their name a while ago.
I didn't know that. So yeah, every day's a school day, isn't it? I want to move on to some alarming statistics in Northern Ireland around femicide. And before I sort of move on to that, at Hourglass, we support any older person, and we hear from a lot of older men. We support about a third of our service users are men. And I know that Poppy said in our webinar last month, Poppy focuses on our people at most high risk. And she said at the moment her caseload is about 50-50. So we need to be really conscious that as men age, the risk of abuse, the risk of domestic abuse perpetrated by all sorts of different relationships, family members, intimate partners, does increase, and that gendered gap does narrow as people age. However, there are some alarming statistics around femicide and older women in Northern Ireland particularly, but I think that is emerging across all four nations. Gareth, could you tell us a little bit about what's happening in Northern Ireland?
Yeah, well, it's a very difficult topic, and obviously, I mean, we talk about the abuse and neglect of older people being an epidemic. In Northern Ireland, femicide is an epidemic as well. I think it's important to say that in isolation. Since 2020, there have been 27 women killed. So since the COVID pandemic, so when you extract, you know, the figures of the demographic that we cater to, that we advocate on behalf of, 8 of those have been over 60. That's 30%. And a not insignificant number 3 have been in their 50s as well. So that's an alarming amount. 27 in itself is alarming. You know, that's 27 too many. So 11 of those are people that we would support in cases. So that's why, you know, I reiterated earlier on in the conversation in our manifesto, we talk about VOG being important, but we also want to do a piece of work with the executive in Northern Ireland to complement VOG. It's not about replacing VOG or undermining VOG. It's about working with VOG to make sure that we get strands complemented that are bespoke for older victims and survivors, so that they can access specialist services that are catered towards their needs, age specific. And again, someone on Frontline Services might want to talk specifically to what those needs are, but there are discrete needs of older victims and survivors that maybe aren't being covered by VOG. I suppose Another thing in terms of this epidemic of violence against women and girls and femicide over the last 5 years, when we look at those, particularly those eight women who are age 60 plus, I can't speak to the circumstances of what happened to them, and I wouldn't do that in this forum. It's not appropriate. But I suppose overarchingly, thematically, in terms of the research that's been done around domestic abuse in later life, domestic abuse in later life can be something that can start off it starts off earlier in life and escalates, and then culminates in homicide in later life. So it's what I always say about anything, and it was something I looked at in terms of mental health. When you look at in terms of safer aging, it's about early intervention. It's about how do you reach any issue before it escalates and becomes fatal, or it's too late to make an intervention. You need to get there early intervention. And we talk about special educational needs, anything. You need, if you want to create a better society, a healthier society, a safer society for everybody, it's all about early intervention, putting the structures in place so we're not playing catch up later on down the line and trying to fix things ultimately. So I suppose another thing to think about in light of this, and again, I don't want to talk about the specifics, but in terms of the context and what we might do better to support people to make sure that this doesn't keep happening in terms of the older victims. What we do know from previous research is that older victims in Northern Ireland, and I think not just Northern Ireland, probably across the 4 nations, is that older victims of crime experience poorer outcomes in terms of investigations and prosecutions. And and this is something and again, it comes back to what myself and Joseph do. It's about breaking through that, initial barrier of the perception and promoting Hourglass as a specialist organization and advocating for funding for specialist organizations such as Hourglass in a very, very difficult environment for funding for community and voluntary sector organizations. There's fewer specialist interventions tailored to the unique needs of older victims and survivors. So we have to shout really loud to get our voices heard, because we are that unique tailored service that can help those people who are experiencing domestic abuse. We are that early intervention that can potentially be that wall against the fatal incident down the line. So, I mean, that it sounds serious. It is serious. We have to put it in those terms. And I think it also, putting Vogue and what we want side by side can sometimes it can annoy people, but it has to be said in those terms, because we are advocating on behalf of a certain demographic. And again, Frontline Services can talk more to this, but what I have picked up and what the research shows is that older victims and survivors, if they don't know about services like ours, they sometimes feel like the other services aren't for them. They feel like it's for younger people. So in that context, what we want to do in terms of the early intervention is we want to get them the Hourglass. We want organizations like Hourglass to be properly funded, sustainable and visible, so that we don't have those 8 women over 60 being murdered. 8 women over 60, the 27 women. We want to reach a stage like Vogue in Northern Ireland where all women and girls are safe. And that starts again, it's a whole cultural shift. It's a whole educational piece as well about how you educate young men on how they treat women. And again, I see echoes in what we're doing around how we treat older people fundamentally as well. When you look at the attitudes in the YouGov survey that we did around the abuse or the attitudes towards abuse of older people, do you consider this abuse? And people think no. Well, it's in that same golden thread of how we treat vulnerable people or how we treat people who would feel vulnerable. So it's all about, it goes back to that idea of recalibrating people's minds. How do we get back to that fundamental way of treating people, decent in a way that is decent fundamentally, and in a way that all people should feel safe. So it's not easy. It's not easy, but I think it goes back to making sure that we are allowing older people to access the services that are tailored to their needs in the overarching needs of women and girls generally. But it's a very disturbing time in Northern Ireland particularly, and I can sense people's anger. There's a lot of different issues going on, and that's one of them. And yeah, you can feel the anger very much on the streets, and I can, women aren't scared, women are angry, and quite rightly, because it isn't a safe place for them, and it's attitudinal, and it needs to change. We have our bit to do in that, I think.
We do. Thank you, Gareth. I could really feel your passion shining through there. And you and I have talked about, we've got this analogy, haven't we, that ageism creates this petri dish for abuse to thrive, and we're kind of lifting the lid on that petri dish. But every single one of us plays a part in growing that conversation. But equally, every one of us could be affected if we're fortunate we get to age. So this matters not only to older people who are frequently othered and dehumanized and infantilized, but actually it could be any single one of us on this call today. And we need to start having these really uncomfortable, difficult conversations, because actually we can all be part of the solution. As you've highlighted, systemically we need massive change, but actually raising awareness is on us all. We can all do that. We all have a little bit of power in creating change, don't we? And it's really important, these webinars, these awareness raising, that we don't feel so overwhelmed that it gets put into the too difficult box. And too often that's what we see. And actually we can all be part of that change, however hard it is. And I'm about to get really passionate and emotional, so we could all get on that soapbox, couldn't we? What we're seeing at Hourglass, certainly some key stats, is that we've seen a 40% increase in contact this year compared to last year. And I know in previous years it's just increased and increased and increased. We are raising awareness. More and more people do know about Hourglass, but we need your help. We need your help to make Hourglass the automatic response when we talk about ending the abuse, harm, exploitation and neglect of older people. The go-to organisation should be Hourglass, and we're happy to work with people to do that. As I said before, we work with about 30% of the people contacting us, or we're supporting our men. We mustn't forget older men in the conversation either. And the average age of our service users is 78. That's this year's data that we have. By 2050, which is kind of the year that we're hoping to create a safer ageing society, I will be 73. So just take a moment to think about how old you will be in 2050. Will this topic be about you? And now we're going to talk about the conference. We have a conference. We had a conference last year. I wasn't working at Hourglass, but I came as a guest. It was brilliant. It was in Brighton. And this year, we're moving it to Scotland. So Gareth, you're very much leading on this. And we've got the conference in Edinburgh on the 12th of November, haven't we?
Yeah, so it's at Heart of Midlothian Football Club, Tynecastle Stadium. So it's a nice city, nice location. Unless you're a Hibernian fan, but put that aside and it'll be grand. Just put it aside for one day. Yeah, so at the moment we've got some really good confirmed speakers. There's Baroness Newlove, the interim Victims Commissioner for England and Wales. We've got Minister from Westminster. Can't actually reveal the name at the moment, but that's confirmed. We'll have Duncan Craig, the CEO for We're Survivors. We have Colin Smith, Scottish Labour MSP, who is he's put forward the bill for the Older People's Commissioner for Scotland. So he'll speak to that idea and why it's so important, and it's something that Hourglass supports. And again, you know, as Joseph said there, it's really important that all 4 nations have that advocate for older people. And Jacob Stewart, the Minister for Qualities in Holyrood, will also be speaking at the conference as well. So we're putting together a really good list of speakers, and there's more to be confirmed in the coming weeks, and we'll be releasing those on social media, and the details are on the website, and the link's just been posted in the chat. So please, if you click on that link, you can get your tickets now. And yeah, there's more fantastic speakers to be added, and there's loads of like brilliant panels, informative panels, and it'll be a great day. And yeah, it's a real milestone in the sort of movement towards a safer aging society by 2050. And you know, you can all do your part by joining in, spread the word, get other people to buy tickets, and share it on your socials, please.
Yeah, we'd really appreciate that. I've put a link to the conference. There's also somewhere in the chat a link to our newsletter. If you sign up to our newsletter, you'll find out about lots of updates on the conference, because we will be releasing speaker details, won't we, and more about what to expect from the day. But also our webinars. We are hosting these webinars every month. We are going to have a break in August. But from September, you mentioned before, we're going to have a Northern Ireland focus and an ageism focus, aren't we, Gareth? And we've got Claire Sugden coming along to that, and other speakers. And we'll have many, many more. So please do sign up and engage with us. We're really keen to grow this conversation. Before we move on, because I'm bound to have forgotten something, I'm going to go to questions in a minute, just to give me a moment. Does anybody else have anything they want to add, or anything I've missed in terms of asking you questions? Silence.
Sounds fine, Carrie. Yeah, looking forward to getting onto the Q&A.
Okay, lovely. Right. Well, feel free to keep posting them. We've got half an hour left, so it's been nice. It's been a really great conversation, a really challenging, emotive topic. But hopefully this brings to life a little bit more about what we do at Hourglass. And I've certainly, I work here, and I've certainly learned a lot as well. So it's not just for external attendees. It's always useful to hear what people are doing. So Ian in the Q&A has asked, do you experience older people not recognising that what has happened to them is abuse? And why do you think that this is not recognised by some people? So whilst you're thinking about the answer, I can speak to that as well. So we talk about this in great detail in my training. So we go through some of those generational norms, some of the policies, the legislation, the way media insidiously shape societal attitudes. So absolutely, Ian, we see that it's really common. A lot of behaviours have been really normalised, accepted. If we think about it, there's certain offences. So, coercive controlling behaviour wasn't a crime in England and Wales until 10 years ago. You think about somebody in their 80s, they're well into their 70s when that's become a criminal offence. How do you expect somebody to suddenly change their perception? That's it's become, and if you think about some of the films that we watch or the books that we read about romance, thinking about intimate partner relationship, actually some of the behaviours in coercive control would have been considered romantic, would have been considered part of that courting process for many older people. And so there's a lot of misunderstanding around what that behaviour is. There's a lot of work across all generations to understand what coercive controlling behaviour looks and feels like, but even more so when that's been your normal for decades and decades and decades. But also then we've got to think about the shame, the stigma, when the person causing us harm is our adult child, our adult grandchild. Many people feel responsible for the behaviour of their children and grandchildren. And so, yes, absolutely, we do see that. And in the training, we really unpack that and why that might be, and why older people have been invisible. Remember, they've been invisible in a lot of the data. The crime survey for England and Wales had an age limit. Up until 2017, we didn't collect data on rape, sexual assault and domestic abuse for anybody over the age of 59. And it wasn't until 2021 that that upper age limit was completely removed. It moved up to 74, but we still had an age limit until 2021. We have very little data in terms of evidence nationally. And I don't actually know about the data across the other nations, but you know, in England and Wales, which is a large data set, older people are invisible. How do we expect older people to recognise abusive behaviour if we've not even been counting them? And then, you know, in that training, we also look at media reporting and the insidious messaging. You know, think about when you see a report about an older person who's been killed, harmed, abused, they will be referred to as an OAP, a pensioner. They're completely dehumanised. And again, that adds to that petri dish of how we other older people. And if people read those headlines, they don't feel seen, they don't feel worthy, they don't feel part of the conversation. Again, I'm on a rant. Anybody want to add to that? Ian's question about recognising, particularly frontline services, you're on the ground, you know, speaking and seeing people. Any thoughts?
I mean, I second everything you say, Carrie, and I think for me, it is one of the things that I find most difficult when I am discussing with the service user to raise awareness with them that their experience is domestic abuse related. And I will get comments, you know, as well, my mum lived through a relationship like it. It was very much the same. What's the problem? It was expected. It's ingrained into them, you know. Or I had a service user say, well, my dad said, you make your bed, you lie in it. These are the kind of mindsets of the individuals that we are working with, that they feel that they have a duty to remain in the relationship that they have built, that they have cemented, and that they have a duty to continue that relationship and the duty to the person, no matter how they get treated. And it can be very, very difficult for them to understand that what they are experiencing is abuse, as you say, Carrie, because legislations have only recently changed, information is only recently readily available. But even though it's readily available, it might not be accessible to the older person because it's only changed recently. It might be on the government website. So yes, we could go and have a look at the new legislations, but maybe they don't have access to internet. Maybe their abuse also kind of takes away their access to finances, takes away their access to communication. So how can that person empower themselves with the knowledge of the changing legislations and what abuse is, if their abuse is stopping them from having that access as well? So it's a very, very difficult conversation that we have to have with our service users.
Thanks, Elizabeth. Any additions before we move on to the next question?
I mean, just quickly from a sort of kind of policy point of view on that, these barriers to reporting abuse, like not recognizing that what's happening is abuse, coupled with isolation and dependency, various other issues. And if you add that to the fact that we didn't have, you know, about the ONS and stopping it at 74, these create huge problems for us when we're talking to the government, because you know, we have to present them with data that shows that this is actually happening. We know it's happening. We have data from our helpline, but because across the four nations, at least definitely in England and Wales, and I'm sure in Northern Ireland and Scotland, the data collection is so poor and fragmented. We don't have enough ammunition sometimes to persuade the government to increase funding levels or change policy. So one of our manifesto asks, which I neglected to mention across all four nations, I think, is improved data collection and you know, proper across all PCC areas in England and Wales specifically, but a sort of uniform age disaggregated format, so that, you know, the invisibility can be reduced just a little bit. You know, older people are definitely invisible as it stands now, and there needs to be huge improvements in data collection for us to begin to improve that.
Thank you, Joseph. And Ian has put in the Q&A, if anybody's not looked at the Q&A, it's really worth looking at. Ian's provided some ONS statistics on homicide statistics. So this is from 2022 to 2023. And you're right, Ian, it is alarming. And the problem with those statistics is they are categorised between kind of 55 and 64, and then 65 to 74, so and 75 plus. So a lot of the data doesn't correlate with other data sets. So it can be really, really hard to kind of explain that in terms that are simple to understand. But it is alarming, and we know that you know, older men become at increased risk. We also know that some of the research is telling us that older people are equally as likely to be killed by an adult child or grandchild as they are an intimate partner or former partner. And that certainly seems to be emerging. That seems to be what we're seeing as well. But I won't get into too much depth there, because it is quite complicated to detangle all of those statistics. But Ian, thank you for providing. There is a vulnerability knowledge practice, I can't remember the other P, what it stands for, VKPP, on older people. If you just put it into a search engine, VKPP, it's in relation, I think, to England and Wales, but there is a specific one, spotlight on older people. It's well worth looking at, and that looks at domestic abuse related deaths, which includes suicides as well. What I would say about that data, again, getting on a bit of a soapbox, is many older people will be killed or will die by suicide, and it will be assumed to be age-related natural causes. There will be a huge number of people that we are just not seeing, and this is because of this awareness. We're not thinking beyond what's in front of us. Think about some of the long-term health conditions that might result in an early death. So, for instance, things like long-term health conditions such as strokes. We know there's a correlation between non-fatal strangulation and stroke, but when somebody gets to a certain age, we stop asking the question. If somebody was 25 and they had a stroke, there would be an investigation, there would be probing around what the causation of that stroke was. People get to a certain age and we just assume it's age-related. And it's the same with things like brain injuries, confusion, incontinence problems we put down to age-related to conditions. We don't probe and ask the questions. And I know Standing Together Against Domestic Abuse, they've recently published a report around health services not asking these questions, not using professional curiosity. It's essential that anybody who has contact with older people has that lens, has that concerned curiosity. It doesn't mean that every older person you're working with has been subjected to domestic abuse. However, 1 in 5 of us will be subjected to domestic abuse during our lifetime. That's 20% of the population. When we think about an older person, do we even consider domestic abuse? Do we ask the questions? How safe do you feel? Think about health appointments. When women, particularly, I can only speak as a woman, I don't know for men, but as a woman, if I have had contact with sexual health services, antenatal care, postnatal care, I've been asked the question privately, how is my relationship? Do I feel safe? That stopped happening. And I couldn't tell you at what age that stops happening, but it does. And for men, I imagine it doesn't happen at all, or if it does happen, it happens very little. These are the things that we need to start asking to open up the question, the conversation. Anyway, again, I'm on the soapbox. Jeanette, you've said, do you find your client base has a previous history of abuse as children or in previous relationships? Now, this will give time for people to think about their answer. I think domestic abuse, this is my opinion, based on 20 years of working with older people and in this sector and being really passionate, that domestic abuse is so common for all of us that it's likely that many people will be subjected to domestic abuse in different relationships throughout the course of their life. But because of those generational differences and the way the world has changed, it's more likely that older people will have been subjected to or witness abuse in their familial relationships. It might be with grandparents, it might be with their parents. Often I will deliver training and people will come to me and say, you've made me think about when I used to visit my grandparents. You've made me think about the dynamics of their relationship. These things, you've made me think about my neighbour whose son I'm a bit concerned about the way he treats his mother, father, etc., etc. These things are likely to be happening on our doorstep. So I would say, anecdotally, because we don't have the data to back it up, that actually, yes, I think it's really common. And that leads on to the other question you've said, Jeanette, which is, do you find your clients need access to specialist mental health support due to their experience? And this takes us back to being trauma informed. We pathologise trauma. People who have experienced abuse and harm and neglect throughout their life, whether that's as children or currently in later life, will often be gifted diagnoses after diagnoses of various conditions. But if we get to the root cause of what's causing their distress, we will often find some form of abuse at the core. That's not to say everybody that's diagnosed with a mental health condition, but I think we overdiagnose people who actually need to be seen, to be heard, to be validated, and to be acknowledged. And don't underestimate the power of that. Sometimes safety, escape isn't the solution. Sometimes a person just wants to be heard, just wants to be validated. And that can be very, very empowering for their long-term physical and mental health. So please don't think that we always have to have all of the solutions to these really complex problems. Many older people will have found their own solutions and may need support as they're getting older, as they're needing to navigate systems, health conditions. It's very, very complex, but I think we can over pathologize what actually is trauma. So again, on a soapbox, I invite some thoughts into that conversation because I know I've kind of just taken over the answers to those questions.
I'll quite happily contribute. I know from working with service users that in general, majority of them will have a history of abuse, either from in children or previous relationships. I know specifically that my colleague has had in the past at least 3 cases of male victim survivors who experienced sexual abuse as children. And then obviously that will have a knock-on effect on their vulnerability and choices maybe that were made later on and in future relationships. I find that a lot of parents who are receiving adult child to parental abuse may kind of state that they thought their child had a really nice growing up, there wasn't any concerns, but when you start to unpick the relationship that that parent had with their spouse, you find that there may have been some underlying domestic abuse or some red flags in there, which could have been then a trigger and the kind of onset for what was happening with the relationship between them and the child as well. So we do try and unpick a bit of the history between the service user and the assumed perpetrator as well. Of course, there are ailments where there might be some dementia in there as well, and there might have not been any history of domestic abuse previously, but the dementia has then started them to kind of act on that domestic abuse. So in general, yes, most people do seem to have that historic and that vulnerability around them that may mean that they are in the future more vulnerable to further abuse happening. And on the back of that, the specialist mental health support, then they would require that ongoing, we get talking therapies, counselling, any type of services that we can support somebody into. We've also got partners within the deaf specialist services, so Sign Health could also help us make sure that we facilitate the best support for that individual, and that they can supply maybe signposting or options to mental health services to meet that individual's needs. So again, it's just going back to that kind of person-centered and making sure that we are going from the starting point, finding out their history, to now, and what support can go and can be useful, beneficial for them going forwards.
Thanks, Elizabeth. Any other additions before we move on to the next question? They're all coming in thick and fast now.
Yeah, I'll put that on a bit for that. I'm trying, yeah, like we might be. There is definitely the element of historical abuse in those situations as well. Even from previous relationships, like whether they reported anything or things like that, it might just come to light after a certain trigger kind of comes up. So it is quite client-led in that way, that it's what they want to talk about and what they're comfortable talking about. In terms of support, and how, like, whether it happened 20 years ago, but then something new has happened now, it's just supporting them through that. Yeah.
Thank you. And also, those that choose to harm cast their net wide, don't they? So I know I've worked with a number of people over the years who their adult child might be a perpetrator of domestic abuse with an intimate partner, but then they might be arrested, they might be charged, they might be released to their parents' address, and we see that quite a lot in terms of bail conditions, that people maybe do choose to use harmful behaviours in intimate relationships, but then cast their net wide and use those behaviours in terms of their older relatives, particularly as their relatives are aging and there are increased vulnerabilities. And I know, and it doesn't excuse, but again, it adds to that petri dish, the sort of COVID cost of living crisis, social care crisis, NHS waiting lists, all of these incremental changes impact older people and therefore create kind of an increased vulnerability in terms of when people might choose to harm. We've got more and more adult children and grandchildren living with older relatives, and therefore that can create a pressure cooker. It can create those behaviours. But again, as you said, Aisling, there may well be that historic element as well. And the reality is, like I said before, it's so common. It's more common than any of us want to admit. But it's so common that, of course, older people, because they have complex life histories, they are more likely to have had those experiences. Anonymous question now. Could you give an example of a type of complex case Frontline Services support on?
I've got one ready, actually.
Oh, good. Excellent. Thank you, Elizabeth.
Right. So when I first started in the service, I supported an individual, and the names are pseudonyms, so it's all anonymised. So I'm going to refer to the individual as Malcolm. And I supported Malcolm. He lived in the southeast of England. He was 76 years old at the time, going back a few years now. So his story is that he was living in the house that he was residing in. He'd been there his entire marriage with his partner, 20 years or so. They made many, many memories in this property, had lots of little trinkets. He was working out in the garden, doing his vegetables and things throughout the spring and summertime. She was his absolute love of the life. They were just a wonderful little couple. She had children, but he didn't. So they were from a previous marriage, but he always treated her children like his own. He loved them and cared for them and supported them. Unfortunately, when she died, he found it really, really difficult to continue that relationship with her children, his stepchildren. He didn't want to lose his best friend, and he didn't really know how to keep up the communication with the children and to be able to offer the support that he was managing when the partner was alive. So he inherited the house after the partner passed away, and the stepson, we'll call him Danny, he always wanted to live at the property with Malcolm and his partner. But he never paid any rent or any bills when he did stay at the property. He kind of only stopped over every now and again when his mum was around. But after she passed away, he started to stay a little bit more regularly. And it became a consistent thing where he was there almost every single night of the week. However, he refused to pay any rent or bills towards the property. He claims that, you know, he should and have rights over the property as it belonged to his mum. And that when Malcolm had married his mum, obviously Malcolm took rights over the property, and Danny was quite sore about that, unfortunately. And he showed that by being by starting to show abusive behaviours towards Malcolm, in the sense that he would know that nobody's watching over Malcolm anymore. He knew that Malcolm was on his own without a partner and without many people to speak to. He was quite isolated. So Danny started to harass him. He started to phone him up when he went out of the house. You know, where have you been? What have you been doing? Malcolm would go to a doctor's appointment and he'd say, well, where have you been? Why have you been so long? Who have you spoke to at the doctor's appointment? These little things started, and they started to develop and got worse and worse and worse over time, till the point where Danny was basically treating Malcolm like a child, timing him when he went out to the shops or to do his paper round, which he volunteered to do so he could get out and about and try and distance himself from Danny and have some space away from the house a little bit. But Danny would start to do things like lock him out of the house if he wasn't home by the time that Danny wanted him home. And again, question him. Danny set up a joint bank account for Malcolm. And he said it was because Malcolm was getting too old, that he couldn't manage his own finances. So Danny was going to take the bank account, take the card, and he would do the food shopping, but he still expected Malcolm to cook the food and have it ready for Danny at a certain time in the weekday or a certain time on the weekend, depending on whether there'd be things like football or something on the TV. It was all very regimented to what Danny wanted inside of this property. Malcolm unfortunately just could not manage it anymore. It got to the point where he actually did ask Danny to leave. He said, I don't want you in my property anymore, please leave. And an incident occurred where it escalated so much that Danny became threatening towards Malcolm. He got right up in his face, became very verbally abusive, to the point where Malcolm could even feel Danny's spit landing on his face and his breath, and it was all very too much for him. So he got in touch with the local authority. The local authority put him through to somebody else, and then they came to us, and luckily he came through to our service and he was referred, and I picked him up. When I picked up Malcolm's case, we initially discussed things like housing, how to secure his housing at home, safety planning, and we went down the injunction route. So we actually supported Malcolm to get an injunction, a non-molestation and an occupational order from the courts. I applied that with him over the phone. I got him special measures, which meant he didn't have to arrive at the court himself in person. We could do everything either via video link or a telephone. I advocated for him throughout the whole process, and we did manage to get an injunction put in place. Whilst we were doing that, on the background of that, I was working with the local authority and the housing team to find Malcolm a new property to move to. We found him a lovely sheltered accommodation with lots of other over 50s, with a lovely little garden where he'd carry on doing his veggies, which he was very pleased about. And we worked, as I say, closely with the local authority to make sure that that place was available for when the injunction was set. So the injunction was approved. The locks were changed on the property the day that the injunction was approved. So the perpetrator, Danny, could no longer enter the property. And Malcolm was given the opportunity to move to the new location from that day onwards. He didn't move immediately. We worked again a little bit together to work around moving his property. So I gave some options and signposting around some various moving out removal companies and things like that. We also did safety planning around that. How safe is it to remove your items? Where can you put them? What are we going to do with Danny's items as well? How can we safely store those for the time being? Is there anybody, a third party, that we could get involved to support Danny coming in and collecting his items while Malcolm's not there? So Malcolm is reducing the risk of any incidences occurring. We managed to work through all of that with all the various different services involved, and Malcolm did move into his new accommodation with lots of other individuals in this over 50 shared apartments. doing his gardening, and the property that he did have was sold. And again, he worked with all of the services and the options that we gave him at the time to I think he sold some of his items, he auctioned off some of his other items, he took some bits with him, and the stepson Danny was provided all of his items from the property. And it was, yeah, it was a really good case from start to finish that proves that services can come together and work really consistently with each other, and wait for those times for the injunction to come in, for the next person to jump in, and working around that safety planning for Malcolm, making sure that we text and phoned him during his safe times whilst Danny was out of the home, while Danny was at work, or we could engage with him through his little volunteering job that he did. So he made sure that he made others who he felt confident to know about his circumstances aware of what's happening. So we had other people involved, other eyes on him, other support, and yeah, really good support from the courts at the time as well. It was just at the beginning of COVID, so they were really promoting those video links and stuff, so we managed to work on those special measures. So yeah, that's Malcolm's story from the frontline service, from frontline service officers. I also have another very short one from the helpline.
Probably are going to have to call it, just I'm conscious we've only got 3 minutes, so
so
we'll
we've
save
got
that for another webinar, Elizabeth.
Yeah, absolutely, brilliant.
But thank you. And that really shows, doesn't it, demonstrates kind of that high risk was kind of routines, rituals, consequences, often patterns of behaviour that might creep up on somebody, that might feel quite normalised, actually can pose real risk and real complexities, but a great outcome. There is another question about dementia, and I'll just quickly cover it because I'm conscious of time and we do need to wrap up. We will work with people who have dementia if they have capacity to consent to a referral, and that's not to say that people with dementia don't still have capacity. So it would depend in terms of where they're at on that journey, but we can certainly give advice to professionals and work with professionals. And I know Poppy, who isn't on this course, our high risk IDFA, is very passionate about this topic and delivers quite a lot of our training around domestic abuse and dementia. And actually, she might not like it, but I'll give her a big celebration. We've just had some feedback from some training that Poppy's done, and it's been excellent. She delivered training to about 96 police officers the other day, and the feedback that she's had has been brilliant. So we can certainly support and advise, but again, that might be working alongside existing specialist professionals. So without further ado, we've got 2 minutes. I want to thank our panelists and my colleagues. This has been fascinating, really rich conversation. And I hope attendees feel hopeful that actually, whilst this is a really complex, troubling, upsetting, emotive topic, we are doing great work, and we want to continue that, and we want to build, and we need support to do that. So please sign up to our newsletter, come along to our conference and meet us in real life, talk to us, make those connections, visit our website, follow us on social media, please like, share our content. You don't have to be a huge part of the solution. You can just help us in any little way that you see fit. But it is a collective. We can't do it on our own. We do need to work with partners. So please do join us. And thank you ever so much for joining us today. Thank you, everybody.